508. I just sent you out the video yesterday, and that was for assignment number 5, the first assignment for week 3. And today I'm going to go and jump into assignment number 6, which is Psychoneuroimmunology, which is a really, really interesting area of investigation. We could devote 2 whole courses to this, but I think exposure is a good thing, and awareness is a good thing for all you guys. All right, so today is July 11th, okay, 2022. So your mock journal article is due, okay? I hope you guys had fun with it. I didn't want you to be too stressed out about it, but I want you to think about designing a study where you would be looking at something like stress or diet or some interaction of the two or something like that. Something that is a wellness kind of intervention would be the concept, okay? All right, let's go into our weekly assignments right here. I do also want you guys to check it out right here. We have on the 18th, okay, so that's next week, okay, we see that the midterm exam is going to be coming up, okay, and then we see at the very end we have the final exam. And basically we draw from the same questions that we used in the quizzes, so it's nothing new, okay? It's just a way to kind of review everything for you, all right? So do calendar that in. All righty, very cool. Let's get into our weekly assignments here. All right, and I always do like, a little review. Remember we talked about stress and the inverted U. We're gonna get a little bit into the inverted U again today, okay? Little bit being good, okay? But too much is bad, okay? And there's a sweet spot for everything. That's the kind of concept. There's different ways of looking at that. We'll see that today, okay? We talked about genetics, okay? So today we're gonna look at the unique epigenetic effect that elevated stress hormones like cortisol have on the expression of genes in your immune system. And so, yeah, it's, how aggressive is your immune system gonna be? We have all these switches, okay? There's nothing more genetically complicated than our immune system, all right? Thousands and thousands of genes are turned on and off, okay? Depending on who you are at that moment physiologically, okay? And so a lot of investigations have gone in and looked at whether anti-inflammatory, pro-inflammatory genes are being turned on to release, okay, to cause the manufacturing and release of different small proteins that are called cytokines that then sound the alarm and trigger a huge activation of your immune system or suppress it. It just kind of depends on the state of your body at that moment in time, okay? Awesome. Now, we also link this back to overall physiology. Don't forget that cortisol, again, causes this elevation of blood glucose, okay, because it's our stress response. We're going to the liver, we're flooding the body with glucose, and then we cause, cortisol causes this kind of generic insulin receptor insensitivity, okay? And then only those tissues that are really in high demand will the glucose go flooding into it, okay? Again, the stress response is supposed to turn on and then turn off, okay? But when it's chronically elevated, okay, that's when this insulin receptor insensitivity becomes a chronic issue and we get cortisol-related diabetes. That is also type 2 diabetes, okay? So you have a combination of, your genetics, your nature, and your predisposition to diabetes and in these gene changes, and then you have the environment, the nurture that can tip the scale, okay? And we talked about a lot of diseases, okay, related to diabetes, okay? So we have diabetic retinopathy. You can go blind from this, okay? You can have stroke, you can have heart disease, okay? You can have kidney disease, okay, or nephropathy. You can have peripheral neuropathy, so the peripheral nerves die off, all from the diabetic condition, okay? And we have immune suppression from diabetes as well, okay? All right, then we linked it to Alzheimer's disease, okay, because of the massive inflammation that happens from diabetes, okay? What's going on there, okay? Well, remember the candy-coated proteins, they don't look normal and the immune system reacts to it like it would react to an infectious agent, okay? Now we're going to superimpose upon that the change in immune function that happens directly from stress hormones, okay? And so that's what we're going to learn today. All right, here we go into psychoneuroimmunology, all right? Like I said, this is an enormous field, enormous, okay? And I wish we could spend an entire semester looking at this, but it's good just to give you guys an exposure to it. And that's the whole point of this class, is we're giving you exposure to everything that is the mind and body connection, okay? So for those of you who are gonna really change your lives or create a career that is all about wellness and how modifying our behaviors can improve our overall health. This is a really important course, all right? Okay, so let's kind of begin with the nervous system, okay? Alrighty, so we learned all about the stress response, okay? The fight or flight response. And this is a reflex, okay? So we call this the autonomic nervous system. I like to call it the automatic. And remember, there are two different components to it. So there's the fight or flight, and there's the rest and digest. So when we look at the fight or flight response, it has, the direct pedal to the metal, increase the heart rate, increase your respiration rate, okay? Increase the delivery of blood to the brain and to your muscles so that you can go, okay? At the same time, so that's all the adrenaline, okay? At the same time, okay, we release the slower hormonal response, the cortisol, okay? That goes down into the liver and says, hey, let's release all that stored glucose so that we can use it right now, all right? And it redirects our physiological functions as well. Let's suppress the immune system, okay, for right now, all right? And let's suppress other types of functions like gastrointestinal motility and all these different things for right now, okay? All right. When we look at this system, okay, it's important to think about this inflammatory cascade, okay? So we talk about it right here. So it's been shown, okay, when you're having an adrenaline rush, that is actually a pro-inflammatory message. So adrenaline actually activates your immune system to increase the release of cytokines, okay? Because there's a good chance when you're having an adrenaline rush and let's say you're running, you might have an injury, you might have a problem, and it's good to have your immune system ready and active so that when you stop being chased by the lion, you can then go in there and do the repair, okay? So our immune system is not just to fight infection, but it's this constant remodeling of tissue and tissue repair all the time is crucial, okay? You got to get rid of the old messed up stuff, clean it out, and then put in new stuff, okay? So that's another important aspect of the immune system. Okay, all right. Now, the whole concept, though, is that the stress will go away, okay? And then the immune system will go in there and do its thing. It's already been put into place. And you don't have all these hormones all over the place, okay? So then we bring into the other reflex that we don't have to think about. Stress has gone away, and we have this opposing part of the nervous system. Remember the parasympathetic nervous system? This is the rest and digest, and you release acetylcholine, okay? In fact, one of the real neat ways of releasing acetylcholine for people that suffer from certain conditions, it's FDA approved for clinical depression, is we stimulate the vagus nerve, okay? Vagus nerve is a communication between the brain and the gut. It releases acetylcholine into the gut, okay? And it also improves brain function in terms of prefrontal cortex control. So vagus nerve stimulation is one of those treatments, all right? So let's get into it now, okay? So this is just kind of this back and forth I want you to think about. So this is, I always provide either a PDF file here, it's a Word file where I copied everything that was important out of the link, just in case you can't access the link. But we can go right in here to this link right here. Really neat Healthline article. It gives us a really simple overview of what is psychoneuroimmunology, okay? And you'll see that acronym used oftentimes, PNI, okay? And there's an advertisement over here about somebody that's suffering from major depressive disorder, which is a big interaction here between our mental state and our immune function. All right. Okay, so we went over this whole concept that we have this communication between the immune system and the brain. It's reflexive. We don't even realize it's happening, okay? As is the case of all autonomic function or automatic function, okay? And we see down here they talk about the different types of immune system messengers that get released. Okay, so they talk about these little proteins called cytokines. Okay, how does our immune system know whether it's supposed to be producing cytokines and releasing them or not producing cytokines and releasing them? Okay, so remember the whole epigenetics thing, right? So that's the whole thing. So depending on the different messengers that are floating around in the bloodstream, the immune system cells are going to turn on the production of these cytokines. And the cytokines are basically a chemical-based alarm system. Okay, it's like a smoke signal, like that is just erupted into the brain, and it sounds the alarm, just like the fire department sees smoke rising up. They get in their fire truck and off they go and they put out that fire. The same thing happens with our immune system. However, it's in our blood and it is these cytokines. We also refer to a specific type of cytokine called a lymphokine, released by the lymph cells that the lymphatic cells that are in our body. So these are the T cells and the B cells. All right. So we see down here they talk about epinephrine or adrenaline. These are all both the same. One is in the U.S., one is in Great Britain. Just naming the same exact hormone. And that they in general, like I said, they're pro-inflammatory. These are going to increase the inflammatory system. All right, and they go through a bunch of really neat studies here that back up this statement, so that you can check those out right there. Okay, all right. So then we look at examples of pathology that erupt from psychoneuroimmunology or PNI. Okay, and we see a lot of autoimmune disorders are a consequence. They are triggered. Excuse me, not a consequence, but they are triggered by heightened stress levels and this pathway of psychoneuroimmunology. Okay, so this right here is an autoimmune skin disorder, and they explain how this elevated release of cytokines consequent to stress and cortisol levels being high and adrenaline levels being high can lead to this autoimmune disorder and a bunch of other ones too. This is just the example they put out there. So you could have irritable bowel syndrome, Crohn's disease, multiple sclerosis, Sjogren's disease. All these different autoimmune diseases get augmented by stress, and we're going to understand how that works here in a second. Okay. We see that there is also a relationship, okay, between cortisol and stress, okay, and inflammation, okay, and cancer. And so there's a bunch of really interesting articles that are connecting the dots here, okay. Coronary artery disease, okay. So we've talked about this. Cortisol, okay, causes elevated blood glucose. Elevated blood glucose can cause diabetes, okay. Elevated cortisol causes visceral fat, okay. All those come together to increase the likelihood of having atherosclerosis. And again, atherosclerosis then is also an inflammatory disease. So we have the blood vessels, okay, full of cholesterol because of the visceral fat that was a consequence maybe of your diabetes, and then we see that the visceral fat becomes very inflammatory and it can cause coronary artery disease. All right, and then they go through, some kind of bottom line and help options down here. So you guys go ahead and check that out. All right, very cool article. So I love putting in a kind of a simple read on that. Okay, all righty. So this then is this concept of inflammation. Okay, we can have different readouts of inflammation. One of the simplest one is if you're having a major inflammatory bout, let's say you've had an infection, okay, bacterial or viral, you'll see that you'll have an elevated white blood cell count. Okay, why does that happen? Okay, well, the white blood cells will count will go up when you have a lot of cytokines stimulating them to undergo cell division. Okay, where are those cytokines coming from? Okay, could be part of it is the adrenaline rush that we were talking about. Okay, and we're going to see this kind of interaction with cortisol as well. Okay, that that chronic cortisol can actually elevate cytokines and inflammation. Okay, but super high cortisol, like we use clinically, okay, to reduce swelling, and that's not even close to physiological. When I inject you with cortisol, it is 100 times beyond what the body can produce. Okay, that will temporarily reduce swelling, but it's got some consequences. Okay, all right. All right, so this goes over this concept of inflammation, okay? And what we see, in going back to the mind-body connection, is so far in every age-related disease of the brain that has been studied, whether it's amyotrophic lateral sclerosis, multiple sclerosis, Parkinson's disease, Alzheimer's disease, stroke, inflammation is highly involved in the precipitation of this disease, okay? All righty, so I talked about this kind of reflex, okay? All right, fight or flight response, rest and digest. I don't have to think about it. The different neurotransmitter systems, the wiring that is one versus the other gets automatically activated, okay? And then I don't have to think about releasing cortisol either. That's automatically activated as well, all right? So this is just this kind of reflex, okay? And then, okay, we don't have to think about the inflammatory cascade that happens consequent to these different actions of whether or not we're stressed or relaxed as well, okay? And so that's what this article is about right here. It's a complicated article, I fully admit it, and I just want you guys to just kind of go over it and enjoy, okay? So I'm gonna go ahead and open this article up right here. All right, it's called the inflammatory reflex, okay? And so what they do, as indicated by right here, just like you guys did it by the abstract right here, they talk about the use of this reflex. Yes, it's important to fight off microbial invasion, or like I said, when you have an injury, tissue repair, all right? All right, and it is very, very much so fine-tuned, okay? And so they talk about the two different aspects, the adrenaline system and the cholinergic system. And the more we can tap into this cholinergic system through meditation, through exercise, okay, through healthy diet, then we can inhibit the acute inflammatory response, okay? That might be inappropriately activated, okay? We don't want to inhibit it if it's appropriate, but the problem is that we have this inappropriate activation that we have from having these highly stressful lives, all right? So, like I said, it's kind of hardwired, okay? But we're gonna look at this as some insight in terms of the treatment of this inflammatory system through behavioral modification, okay? Alrighty, so they kind of go through, and you know, again, I just want you to kind of go through these articles and read them. Don't get caught up in the details, okay? And so we look at, you know, the inflammatory response, okay? So insufficient responses, as I indicate right here, that can result in immune deficiency, okay? That can lead to infection, cancer, okay, all kinds of different problems, okay? Excessive responses right here, okay? That creates its own sickness and its own disease and its own deaths, okay, sorry. And we see here rheumatoid arthritis, Crohn's disease, atherosclerosis, diabetes, Alzheimer's, okay, multiple sclerosis, on and on and on and on, okay, from chronic elevation of the inflammatory system. Alrighty, they talk about here, about the inflammatory system. There is this double-edged sword where if you don't have enough, you'll die of the infection, but if you overshoot it, then you can have this overactivation immune system that can lead to the shock of sepsis, okay? Sepsis is when the bacteria is overpopulated in the blood, but we go into a physiological shock because the immune system is too active. In fact, this is exactly what was happening in the coronavirus pandemic, when people got COVID and were hospitalized, it was because the immune system was going so crazy. We had massive inflammation in the lungs, and it overshot its mark. Okay. Alrighty, very cool. So this is a review of the nervous system, how it works, okay, and how it's unconsciously controlling heart rate, blood pressure, okay. It goes through a little bit of the neuroanatomy, all right, sorry about that, but the hypothalamus, okay, relays the sympathetic and parasympathetic, okay, fight or flight, rest and digest, okay, they go through that right here, okay. And they talk about we can gain some conscious control right here, okay, and that's where through meditation, you learn to slow your heart rate down and things like that, okay? So that's really important to think about, right? All right, the major player, okay? Tumor necrosis factor, okay? We have a lot of inflammatory cytokines. This is the most prominent one. This is the one that has the most notoriety. And this is actually the one that causes a large amount of capillary leakage right here, as they see right here, and really the downside of hyperinflammation. Okay, where tissue begins to become compromised and become diseased. All right, so we actually have a drug, a very common drug that goes after this TNF. It's called Humira, okay? And it's used for a number of different drugs, a number of different conditions, I'm sorry. So we can just kind of come over here, move myself out of the way, and we can just kind of type in Humira here. We can take a look at what Humira is all about, okay? There's a lot of other drugs you see right here that are of the same concept. What we want to do is we want to look at Humira, okay? Because there's a whole different type, there's whole different sets of inflammatory cytokines that we can go after. All right, so what conditions can we treat with Humira? And so we see here, there's a whole slew of them. We have rheumatoid arthritis, okay? We have plaque psoriasis, Crohn's disease, okay? Ulcerative colitis, okay? Psoriatic arthritis, okay? Ankylosing spondylosis, okay? Arthritis, on and on and on here, all right? So these are all the treatments, all the diseases that Humira is used. And the way Humira works, the reason I throw that up there, is Humira works by going after TNF alpha, okay? And it's an antibody that grabs hold of TNF alpha and takes it out, right? So you're not going to get that inflammation, right? They talk about other types of inflammatory cytokines, okay? Interleukin-1 is another one right here that's being targeted. There's an antibody that is raised against interleukin-1 that is used to target other diseases, okay? All right. And they talk about these monoclonal antibodies, and that's what that Humira is. It's a monoclonal antibody that it shows all these health benefits, both in research and now clinically, all right? Okay. They talk about anti-inflammatory responses that can inhibit inflammation, all right? And so, which ones are these guys? Okay, so we have interleukin-10, all right? Transforming growth factor beta. These guys are released to shut down the inflammation response. And they talk about glucocorticoids here and other hormones right here, okay? That in lower doses, they actually inhibit the production of IL-10 and TGF beta. So you can't shut off the immune system and you can't shut off the cascade, all right? Okay, so this goes over this communication now between the immune system and the nervous system, okay? It is a back and forth effect, okay? So inflammatory cytokines can also cause increased activity of anxiety pathways in the brain and clinical depression. All right, so here's the cholinergic anti-inflammatory pathway, okay? So we can actually, like I said, stimulate this by stimulating the vagus nerve, okay? And it affects heart, liver, okay? Right, as we see right in here, okay? And we see that there's acetylcholine right here. It activates the acetylcholine receptor, okay? And that's going to influence or decrease, see that negative right there? So that negative sign right there means it's going to decrease the release of TNF alpha, interleukin-1, both inflammatory cytokines, and this other one right here that is still under investigation, all right? So anything we can do to increase the cholinergic output is going to slow down this inflammatory cascade. That's the whole point of that guy right there, right? So it's shown that vagus nerve stimulation suppresses inflammation, all right? So we can do this by measuring the inflammatory cytokines. And like I said, vagus nerve stimulation is used to treat clinical depression. It's used to treat epilepsy, and it's also been FDA approved for treatment of migraine headaches. At the same time, it's been shown to reduce the overall level of inflammation in the body, and you can look at C-reactive protein or some of these other cytokines that we talked about with like interleukin-1 and TNF alpha. Okay, awesome. All right, this is another pathway, again, showing acetylcholine, again, reduces TNF alpha, okay? Pain, okay, a whole different pathway, okay? And this is a different transmitter we're gonna get into, but substance P can actually increase TNF alpha, okay? So pain's associated with inflammation, all right? And then adrenaline or noradrenaline, we see right here, generally increases TNF alpha, but it can go both ways, all right? Awesome. So reflex inflammation, inhibition of inflammation. All right, so this talks about how we do this. Nicotinic, that is the acetylcholine. Cholinergic, that's the acetylcholine. That's the rest and digest. Okay, and so we can see these. This is again highly diagrammatic. Okay, but if we can stimulate our vagus nerve to release acetylcholine, then that's going to influence everything we see down here in terms of TNF alpha and interleukin-1, okay? And glucocorticoids influences this as well. And they go over here to the right and they look at biofeedback and meditation and how that's going to influence this vagus nerve stimulation. Acupuncture has been shown to do this as well, okay? And so these are all different mechanisms of having the rest and digest system activated so that we can have this local activation of the cholinergic system that's going to reduce inflammation. There's also evidence that we can give drugs that will do this as well, and that's what that's all about right there, okay? All right, very cool. So again, read through that. I just kind of gave you a quick overview. It is complicated, but don't worry about it, all right? All right. So in this article right here, we're going to look at another short article, 3 pages, actually 2 pages long, by our favorite stress guru, all right, and that's Robert Sapolsky, okay? What Bob Sapolsky does in this article is he goes through an amazing study that, again, looked at primates, just like us, looked at social hierarchy. So he talked about the study right here and how it was set up, and then looked at correlations, okay, between levels of cortisol, social hierarchy, stress, okay, levels of cortisol, and the activation of a couple of key elements in our immune system, the killer T cells and the helper T cells, okay? As he goes through this, he talks about, again, the different kind of molecular pathways. This is a key, remember we talked about which genes get turned on. This right here is the NF-kappa B. It gets turned on and it goes boom, release all kinds of inflammatory cytokines and also put these inflammatory proteins out there on the surface of cells, okay? And yes, high levels, chronic levels, not super high, but chronic levels of medium levels of cortisol was associated with hyperactivation of this immune system, okay? And as he talks about in here, how we have to kind of rethink the concept, okay, in terms of levels of cortisol and how there is a sweet spot in terms of cortisol, where if you have chronically kind of mid-range levels activation of cortisol, it can be a problem. And that's what I'm showing you down here. So we have this kind of biphasic model, okay? So in terms of activating our defense mechanisms and our immune system, okay, we want to have a certain degree level of inflammation with physiological levels of stress, okay? We want the adrenaline to get things going, okay? And even cortisol itself, okay? They can inject it, and low levels can get things going in terms of inflammation, okay? Alrighty, and you get up here, however, when you get to higher levels of stress, so this is super levels of stress, this is not the sweet spot. Now you have a very high inflammatory range, so we want to be down here, high inflammatory range, high immune function, as we've seen right here. And then this right here, this is pharmacological. Again, this is a 10-fold higher range than normal. This is what you get when you inject steroids directly into, say, a joint to reduce swelling, okay? Now, you can't do that all the time, okay? Why? Because it's so high, it completely suppresses your immune system and leaves you really, really vulnerable to infection, okay? It also, the high levels of steroids can lead to elevated LDL. High levels of steroids leads to diabetes. So it's not something you can do all the time. So we want to be down here in this range, okay? This is genetically right here, somebody that that can control it right here. And then this is in this particular article, they're looking at somebody that was physiologically depressed and had much higher stress levels here. All right, cool. Now, what we want you to do then is you read this information. Then there's a short video about this really amazing center, okay? The Cousin Center for Psychoneuroimmunology at UCLA. And they talk about these studies. They talk about, again, looking at cortisol and stress and how it affects the immune system, but they also look at people that have chronic injury and inflammation and how that affects the brain and likelihood for depression. So it's this back and forth action. And then in this particular video right here, there's a real neat study in terms of looking at high levels of stress and how that impacted older people's ability to mount an immune response to a vaccination. Did they create an army of immune system cells that would protect them, okay? And how stress influenced that, okay? And then they also looked at stress and one of the really sad consequences to diabetes, okay? And from the lack of circulation that happens in the lower limbs of diabetes, people get foot ulcers and infections, and they looked at stress, and so it was a real neat study that she performed, and that's what that's all about. Okay, lastly, I just threw this in, okay? This is just published, okay? It was just talked about in right here. We have USC News. It's all over the public relations media for USC. Studies done out of Eileen Crimmins group at USC, and it talks about this chronic stress and how that can cause kind of an acceleration of age-related decline in immune function. And that goes back to what we saw here, okay, in terms of why older people don't mount a good immunity to a vaccination, why they're more likely to get infections, and how that is complicated by stress. And so that's what this is right here. All right, guys. So pretty easy prompt. You think about all this, okay? And that is our overview for today. So we look forward to reading all of your papers. They're coming in today, I know that. And we'll be providing straight up and steady feedback on all this. And peace again. There's talk about stress. There's Julia pregnant with our first boy right there. Okay. All right. Peace.